Afternoon, everyone. It's Bob Yeshke, the Grizz, making another video. This time it's going to be on some basic first aid. I'm going to do a general overview first, and then later on I might do some sequences or sequels like fractures, suturing, so forth and so on. Okay? First of all, let me let you know that I am not a medical professional. I am a paraprofessional. Have been a Navy corpsman during Vietnam and trained, Army medic, a surgical technologist, orthopedic tech, working in the operating room for 44 some odd years. I've taken the EMT course basic, and I'm due to take the wilderness first aid course. I've taken the Red Cross first aid course, so I know a little bit about something. It's going to be very basic, so that is my default. Anyway, I would encourage everybody to take some sort of a first aid course. This is the American Red Cross. Get your CPR card, take a basic first aid course. It'll help you and your family and friends. Okay. Secondly, if you're going to be out in the woods a lot and camping and backpacking and whatever, I'd take the wilderness first aid course. It's basic first aid, except there's some assessment and movement of the patient and immobilization and so forth. But the treatment's pretty much the same as a regular basic first aid course. Now, a lot of you guys carry these big trauma cases and quick clot and all this other stuff. Well, I don't know where you guys are going, but I've been in and near combat, and you're not going there. You're going backpacking, okay, or you're going camping, or you're bushcrafting, okay? So I would think what are your most common injuries you're going to have? And they're probably cuts, fingers, from knives, big gashes from axes or saws, whatever, splinters. I'm not going to talk about insect bites and things of that nature. I'll talk about kind of basic wounds today. And maybe a dental emergency or an eye emergency. Your lean-to might collapse on you. You might have some fractures. But other than that, other than smoke inhalation from your fire, you guys probably aren't going to have anything too drastic, too big. All right. So what I carry in my first aid kit is Band-Aids. I carry, and they might come up glistening because of the bag, but I carry a multitude of different sizes, different lengths. They're cheap. They're effective. You can use them as a butterfly bandage to stop bleeding where you need to have a suture. I use Band-Aids. This is about all I carry in my backpack. I have different types of Band-Aids. I have some butterfly type Band-Aids. I have some small Band-Aids. I actually have my glue from my air mattress, can be used in a pinch along with other adhesive type glue, super glue, whatever, to bind a wound. Pine pitch, whatever. Okay. So just a myriad of Band-Aids, and I take a big compressant type pad. All right. One of the best pads to use, and I said this in a prior video, are Kotex, in different sizes, for different months, for different weeks, for different women, okay, or men. All right. They make great compression dressings, and they're good to stop bleeding. Along with that, if you go to any of these military surplus sales, or you go to a knife gun show, you might find some outdated compressed bandages like so. They have the ties on them. You won't have to use a shema or a scarf or whatever as a tie or paracord. And even though these are out of date, they're still packaged, they're clean, and you're in a dirty environment anyway. So you could use them. All right. I like to take Q-tips along with me also. They're great for cleaning your ears. And they're great for applying any type of salve or bacitracin or a betadine solution or iodine, whatever, to the wound. Okay, so I have long ones, and I carry some short ones along with more matches. Okay, I'm a match guy. All right. Another thing about wounds, if it's too spread apart, bleeding profusely, and you think that it's going to need some stitches down the road, but you can't get there right away, they have what they call a liquid Band-Aid that you can put on it. There's Mastisol. Okay. You can use betadine spray or liquid, which they use for taping for athletics. It's basically an iodine sticky tacky sort of thing to hold on tape, so forth. But this is Mastol. It's using the OR. Put this down, let it get sticky and dry. And then we use steri strips. You may be able to find them in different sizes. They peel off. I'm not going to peel these off. And you can pull the skin edges together, okay? And later on, usually it's still it works. You put a Band-Aid over top of it. You just keep it that way for a couple of days till it falls off. Usually that works. You don't even need stitches. Just depends on how deep the gash or the cut is. All right. Moving on along with that type of thing. It's always good to carry some. These are Keith needles. You can buy upholstery needles, which is a similar needle but maybe a little thicker. For those of you who do not have needle holders or are not really adept at suturing well, this is probably the best way to suture is with a straight needle. Okay. Like I said, upholsters, needles, and these are called Keith. All right. Another needle we have is this is a small Mayo or tapered or round needle. It's on a needle holder. I'm left-handed, so that's why the needle's position is such. Down the road, I will talk a little bit about suturing. All right. And of course, you need some suture scissors. You may have them on your Leatherman, Gerber, whatever. You may trim your nose hairs with these. That's what I do. Or it makes a good little scissor. There's Pakistani scissors out there. Go to a cosmetic shop where women trim their nails and do everything and so forth and so on. They have these types of scissors there. It's curved, straight, whatever. Use the curved ones for dissecting if you want to take the fat, the epidermis, or soft tissue away from the skin edges so you can clean up, have a nice suture edge. Okay? There, scissors. All right? Down the road, everybody should carry a pair of EMT bandage scissors. Not only cutting dimes in half or cutting pennies in half so you can make change. They're good all-around scissors, shears for anything. They're light. They're inexpensive. These actually have there's a hole here where you can strip wire or you can cut pins, or for cutting Steinman pins when you put into the bone to align fractures. But anyway, there's Pakistani types. These are German. All right. If you can find German, get German. They're better made. These are Esmark bandage scissors, not to be confused with Lister, which are a little thinner. I carried these, or this type, when I was a Navy corpsman, Army medic, and as an orthopedic tech. Always had a pair of scissors on me, even in the operating room. Okay, next. If you have a wound, and you have a little bit of pain going on, whatever, baby aspirin. Can't go wrong. Chewable aspirin, 81 milligrams. Good for your heart. Okay, you can dilute them in water and swallow them that way. So for pain, inflammation, aspirin, 99 cents. All right. I take a herbal Bioflex, OsteoBioflex. There's a number of different ingredients. It's herbal along with chondroitin and MSM, which is a mineral for bone or cartilage regeneration. And this is for my general aches and pains. So if you're backpacking, you're carrying a pack for a long period of time, might help you out. The other thing is I'm a big vitamin guy. This keeps skin tissues and your overall health well. This is a men's chewable multivitamin. I take them with me all the time whenever I camp or backpack. Back to irrigating wounds. A little ear syringe. Okay. I got some hand sanitizer. You can put that in some boiling water. The greatest thing is Dr. Bronner's Castile soap. This is peppermint. I use it to wash every day at home. Okay. There's eucalyptus. There's hemp. There's all types. Great all-around soap for disinfecting, lavaging, irrigating. Put a couple drops in your canteen cup or in your bowl. Bangity bangity. Add some nice boiling or steaming water in here. Mix it up. Let it cool down a little bit. Put your irrigator in. Suck up some water. Go to your wound. Lavage it. Irrigate it. Go back again. Whatever. If you have iodine, you can dilute it in water and also do an iodine lavage. Okay. That's just for keeping the wound clean, getting any type of detritus or dead skin or materials, tissue, bugs, boogies, whatever, out of your wound before you tape it up. All right? So that's that. Another thing we don't talk about much is our teeth. You should brush your teeth when you're out in the woods. Also, if you come down with a toothache, they sell these over the counter. This is Kanka Soft Brush Gel. For cankers or the lip, herpes type cankers. These will do you good until you can get to a dentist. All right, they have an applicator on them, so forth. All right, if you have to play around with a loose tooth or something that's really bothering you, Here's the dental pick. You can go inside the cavity, scrape out any detritus that's in there that you need. Here is a mirror so you can see in the back of the mouth. Okay, and you have this called DentTep. It's a filling for loose caps and or an emergency fill that you might need till you can get to a dentist. Okay, this is over the counter application, whatever. Very simple. Follow the instructions. Another thing I carry around is plackers. I wasn't much of a what do you call them? Using the God, I'm having a brain dump right now. But you know the little rope you clean your teeth with, you know, whatever. That's good for suture also. So these work really well. You have a pick on the end. You can use these to pick out splinters, so forth. Flossing. Brain dump, going to be 64 soon. If you can get a collapsible scalpel, like such, okay. This is a 11 blade. It's a pointed blade. Suture, removing, how you would call it, splinters, so forth. Cutting off some skin edges. There you go. All right. Let's see. What else can I talk about real quick here? Everybody goes to this this quick clot emergency bandage and stuff like that. I mean, this is like for like really bloody trauma. I have one. It was given to me by one of the SF medics I work with. You know, Kotex would work. All right. The other last thing I want to talk about is tourniquets. This is one I have in my my case. I don't promote tourniquets. They're dangerous. They can hurt people if you don't know how to use them. So I have one. I think you need to take a class. This is a CAT. Okay. It hasn't even been opened. You have a belt, a BDU belt, which is about 1.5 to 2 inches. Has a constricting band. Okay. You can use some elastic rubber tubing off your slingshot. Okay, that you can put above. Not so tight that it totally cuts off circulation, but that it slows bleeding. And then you have to put compresses on it, wrap it, little ACE wraps. You might want to take some 4-inch ACE wraps, whatever. Compress, compress, compress. It bleeds through. Compress some more. Elevation, and get off to a hospital and treat for shock. Okay, so this is a little basic overview. Don't have much more to say about it. So if you have any questions, comments, feel free to put them in the comment section. Whether you subscribe or not, it's not up to me. I'm not making any money off this. I'm just doing this as educational teaching and to become a video star. So anyway, hope you enjoyed it. You guys have a great day. This is Bob the Grizz. God bless and out.